Welcome. In this segment, we will discuss about the pathologies that affect the normal hemostatic processes that takes place in the body. In the course of the previous lectures, we were able to establish the fact that the body responds to insult by formation of what hemostatic plaque. But when the processes that are involved in the formation of that particular hemostatic plaque are affected, medically, it is termed hemostatic disorders. So what are hemostatic disorders? Hemostatic disorders can be defined as those pathologies that affect the normal process in which the body responds to insult. Even as we have known that there are three major components of the hemostatic process, hemostasis involves three major components. They include the platelet, the vessels, as well as the coagulation factors. So hemostatic disorders can affect one of these components. When it affects the vessels, we call that vascular disorders. When it affects the platelet, we call that thrombocyte disorders or platelet disorders. And when it affects the coagulation factors, we call that coagulation disorders. So in this particular segment, we will talk about vascular disorders, we are going to talk about the coagulation disorders, and we are going to talk about the platelet disorders. So I want you to take a good look at this picture. This is Kelvin. And Kelvin is the son of John Doe. Kelvin has been suffering from recurrent epistasis for a long period of time. They've went to the hospital several times, but there wasn't any definite diagnosis for Kelvin. It was unfortunate that this particular incident led to the death of Kelvin. It was after the death of Kelvin that the clinicians were able to establish this particular diagnosis. So it was unfortunate that their diagnosis was a disorder that affected the blood vessels of Kelvin. It was a very, very rare disorder that the clinicians usually would overlook it. So what I want you to do right now is to sit down tight on your seat while we go into this journey to discover what actually affected the vessels of Kelvin. So, like we've said before, whenever the vascular component of the hemostatic process is affected, we call that vascular disorders. So what are vascular disorders? So vascular disorders can be defined as those pathological processes that affect the vessels which constitute the cardiovascular system. But these particular vascular disorders, they are also known as non-thrombocytopenic purpures. And these particular vascular disorders, they are characterized by easy bleeding into the skin, easy bleeding into the mucous membrane that lines the internal part of the body, as well as normal level of the platelet in the plasma. Of course, it's obvious. Since the disorder only affects the blood vessels, it doesn't affect the plasma. It doesn't affect the other it doesn't affect the coagulation factors. It only affects the blood vessels. So you expect that the normal values of the platelet, which is normally 150 to 400 by 10 to the power of 9 per liter, that's the normal value of the platelet. So in patients who are having non-thrombocytopenic purpures, you are going to see the normal value of the platelet. So we've said that during the course of these non-thrombocytopenic purpures or vascular disorders, we have recurrent bleeding into the skin, we have bleeding into the what? The mucous membrane. So, in the course of these particular lectures, we are going to dwell much more deeper into disorders affecting the platelet, as well as disorders affecting what? The coagulation factors. So, but before we go deeply into the main business of the day, we are going to take a good look at a few disorders that affect the vessels. So the first disorders we are going to take a look is called HHT, Hereditary Hemorrhagic Angioectasia. Remember the story of Kelvin that I told you about? I told you that Kelvin died because the doctors overlooked a particular pathology that occurs very, very rare. And it was unfortunate that that very rare pathology was responsible for the death of Kelvin. And that pathology is what? That pathology is the hereditary hemorrhagic angioectasia. So hereditary hemorrhagic angioectasia is an autosomal dominant disorder affecting the blood vessels. In this particular disorder, it is characterized by the dilatation of the capillaries, as well as the dilatation of the small arterioles. When we have such dilatation of the capillaries, as well as the dilatation of the small arterioles, we have a characteristic small red spot that usually appears on the skin of the patient. It also appears on the mucous membrane of the patient. But this characteristic small red spot, they usually disappear on pressure. They disappear on blenching of the skin or blenching of the mucous membrane as a result of pressure. So patients suffering from HHT, which is a hereditary disorder of transmitted through autosomal dominant pathways, usually present with recurrent epistasis, guys. They also present with recurrent bleeding into the GIT. So as a result of chronic or recurrent bleeding in the GIT, this particular patient might suffer from iron deficiency anemia. So the next disorders we are going to talk about is the easy bruising syndrome. So this easy bruising syndrome is mostly found among healthy women, and it is mostly characterized by bruise, like the name depicts, easy bruising syndrome, which simply means these particular healthy women, they are easily prone to bruises. Even a minor trauma that's normally not supposed to cause a very major bleeding or major bruises, those women who are affected by this particular syndrome, they tend to have a bruise, very serious bruise from traumatic agent that are not supposed to cause such a serious bruise. So you can mostly find this bruise on the legs, on the arms, and also on the trunks of these women. However, the occurrence of this easy bruise syndrome should help you to know that these particular women are much more prone to having a very serious hemostatic disorder. So before we continue, guys, I will want us to take a short break.